Hello, everyone. Today, I want to talk about something very important for people over 60. Tomatoes are a food many of us enjoy every day. They're in salads, sauces, and so much more. But as we get older, our bodies change, and sometimes foods we love can affect us differently. Tomatoes are healthy in many ways, but they can also cause some unexpected problems for older adults. In this video, I'll share 7 surprising reasons why eating tomatoes after age 60 might not always be the best choice. If you eat tomatoes regularly or just love their taste, this video will help you understand how they might impact your health as you age. I'll explain things clearly and simply, so you can make the best decisions for your well-being. Stay with me until the end to learn these important facts about tomatoes and your health after 60. Tomatoes can upset your stomach. As we get older, our digestive system often becomes more sensitive. Tomatoes contain natural acids that can sometimes irritate the stomach lining. For people over 60, this can mean discomfort like stomach pain, heartburn, or indigestion after eating tomatoes, or tomato-based foods like sauces and soups. This happens because the acids in tomatoes increase stomach acidity. If you have a condition like acid reflux, gastritis, or a sensitive stomach, eating too many tomatoes or eating them on an empty stomach may make symptoms worse. Some people might feel a burning sensation or discomfort shortly after eating tomatoes. To reduce these problems, try eating tomatoes with other foods. For example, having tomatoes with bread, cheese, or healthy fats like olive oil can help protect your stomach by balancing the acidity. Also, avoid eating large amounts of tomatoes at once, and don't eat them on an empty stomach. If you notice stomach discomfort regularly after eating tomatoes, it's a good idea to talk to your doctor. They can help you find the best diet for your health and suggest alternatives if needed. Remember, not everyone will have these problems. Some people over 60 can enjoy tomatoes without any issues. Just listen to your body and adjust your diet based on how you feel.
Tomatoes might increase joint pain. Many people over 60 experience joint pain due to aging or arthritis. Some studies suggest that tomatoes, which belong to the nightshade family, might make joint pain worse for certain individuals. The nightshade family also includes potatoes, peppers, and eggplants. Tomatoes contain a natural chemical called solanine. In some sensitive people, solanine can increase inflammation and worsen joint discomfort. If you notice more stiffness, swelling, or pain in your knees, fingers, or other joints after eating tomatoes, this might be why. It's important to remember that not everyone reacts this way. Many people eat tomatoes without any joint problems. But if you have arthritis or joint pain, it's worth paying attention to how your body responds. Try reducing or avoiding tomatoes for a few weeks and see if your joint pain improves. Keeping a simple food diary can help you track what you eat and how your joints feel. As always, talk to your doctor before making big changes in your diet, especially if you have health conditions or take medications. They can give you the best advice for your situation. In short, tomatoes might increase joint pain for some people over 60, so it's good to watch your body's reaction. Processed tomato products can be high in sugar and salt. While fresh tomatoes are healthy, many processed tomato products, like ketchup, tomato sauces, and canned tomatoes, often contain added sugars and salt. These added ingredients can cause health problems, especially for people over 60. Too much sugar in your diet can increase the risk of diabetes, weight gain, and heart disease. High salt intake may raise your blood pressure, which is dangerous for older adults. Since many tomato-based products have hidden sugar and salt, it's important to read labels carefully. If you have health issues like diabetes or high blood pressure, cutting back on processed tomato products with added sugar and salt is a smart choice. Instead, try to use fresh tomatoes or make your own sauces at home with fresh ingredients and less salt and sugar. Also, be cautious with portion sizes. Even healthy foods can cause problems if eaten in very large amounts. Moderation is key to keeping your diet balanced and safe. In summary, fresh tomatoes are good for you, but processed tomato products can contain added sugar and salt, which might harm your health after 60. Choosing fresh or homemade options can help you stay healthier. Eating tomatoes without healthy fats can limit nutrient absorption. Tomatoes are rich in a powerful antioxidant called lycopene. Lycopene is known for many health benefits, including helping protect your heart and lowering the risk of some cancers. However, your body needs healthy fats to absorb lycopene properly. When you eat tomatoes alone, especially raw, your body doesn't absorb as much lycopene as it could. But if you eat tomatoes with healthy fats like olive oil, avocado, or nuts, your body can take in much more of this important nutrient. For people over 60, getting enough nutrients from food is very important. So, adding a little healthy fat when you eat tomatoes can help you get the most health benefits. For example, cooking tomatoes with olive oil or adding avocado slices to a tomato salad are simple ways to improve absorption. Without healthy fats, you might be missing out on some of the good things tomatoes offer. So next time you eat tomatoes, try pairing them with healthy fats to boost your health naturally. Tomatoes can interact with certain medications. If you are over 60, you may be taking medications for conditions like high blood pressure, blood thinning, or heart problems. Tomatoes contain vitamin K, a nutrient that plays a role in blood clotting. While vitamin K is good for your health, it can sometimes interfere with certain medicines, especially blood thinners such as warfarin. If you eat a lot of tomatoes or tomato products regularly, it may change how your medication works. This can make your medicine less effective or increase the risk of side effects, like bleeding or clotting problems. It's important to keep your vitamin K intake consistent so your doctor can adjust your medication properly. If you take any medication, always talk to your doctor or pharmacist about your diet. They can help you understand if tomatoes or other foods might affect your medicines and guide you on how much is safe to eat. Remember, you don't need to stop eating tomatoes completely, but knowing how they interact with your medication can help keep you safe and healthy. Eating too many tomatoes may cause kidney issues. Tomatoes contain a mineral called potassium, which is important for your heart and muscles. However, if you have kidney problems, eating too many tomatoes might cause your potassium levels to get too high. This can be dangerous, especially for people over 60 who often have weaker kidney function. When kidneys don't work well, they can't remove extra potassium from the blood properly. High potassium levels can lead to serious health problems like irregular heartbeat or muscle weakness. That's why doctors often recommend people with kidney disease to limit foods high in potassium, including tomatoes. If you don't have kidney problems, eating tomatoes in normal amounts is usually safe. But if you do have kidney disease or notice symptoms like tiredness, muscle cramps, or heart palpitations, it's best to check with your doctor. They may advise you to reduce tomatoes and other high potassium foods in your diet. Remember, balancing your diet and following your doctor's advice is very important to keep your kidneys and overall health strong as you age. Tomatoes may cause allergic reactions in some people. Although tomatoes are healthy for most people, some individuals, especially older adults, can develop allergies or sensitivities to them. Allergic reactions to tomatoes are not very common, but they do happen. Symptoms can include itching or swelling in the mouth and throat, skin rashes, stomach pain, or even difficulty breathing in severe cases. These reactions usually happen soon after eating tomatoes or tomato products. If you notice any of these signs after eating tomatoes, it's important to stop eating them and talk to your doctor. They can help you find out if you really have an allergy and suggest ways to manage it. Sometimes people with pollen allergies may also react to tomatoes due to a condition called oral allergy syndrome. This is because certain proteins in tomatoes are similar to those in pollen. If you suspect a tomato allergy or sensitivity, your doctor may recommend tests to confirm it. Avoiding tomatoes and tomato products can help prevent uncomfortable or dangerous reactions. For most people over 60, tomatoes are safe to eat. But if you experience any unusual symptoms, be cautious and seek medical advice. Your health and safety come first. Tomatoes are a popular and tasty food, but after 60, they might cause some unexpected problems for certain people. From stomach discomfort and joint pain to possible interactions with medications and allergies, it's important to pay attention to how tomatoes affect your body. Remember, not everyone will have these issues, but if you notice any problems after eating tomatoes, talk to your doctor and consider adjusting your diet. Eating tomatoes with healthy fats and choosing fresh over processed products can help you get the benefits without the risks. Your health is the most important thing, so listen to your body and make smart choices. If you liked this video, please subscribe, leave a comment, and share it with your friends and family. Stay healthy and take care.
Thanks for watching, and don't forget to like, subscribe, and hit the bell icon for more health tips and advice.